Helping young adults with disabilities transition from school to the workplace is one of the missions of the Mental Health Association of Springfield. MHA offers 3 residential programs that prepare young adults for the next phase in their life. Carolee McGrath recently sat down with a participant in MHA's Young Adult Residential Program and shares his story.
Just picked this up out of the mailbox.
21-year-old Havier Connors reviews his progress with Marcus Garner, a program supervisor of the Mental Health Association's Young Adult Residential Program in Springfield. Havier lives in a home with other young adults with developmental disabilities, ranging in age from 17 and a half to 26, who are not quite ready to live on their own. The program, run by the Mental Health Association, or MHA, is funded through the State Department of Mental Health. Havier is on the autism spectrum.
When I first got to the program, there was things I didn't want to do and didn't know of. And then as time progressed, the staff, Marcus, helped me and told me about different things that would help me. And I trust them, so I listen to them and I do it.
The MHA program helps other young adults with developmental, intellectual disabilities, or psychiatric problems transition from public school-based special ed services and support, which end when the child turns 22. Now, in his 3rd year in the MHA's Young Adult Residential Program, Havier is making strides.
I do chores, cook, do my laundry, keep my room up to date. I go out and to the community and whatnot.
Tell me a little bit about Havier.
Havier is one of the best guys in the program. He is. He's one of the best guys in the program. Havier, he takes he listens to staff when we're trying to give him a direction, because a lot of people come in, they got their own fixed ideals about, what it is that they want to do, but it's not going to get them to where they want to go. And so Havier, he's open, he's willing to take suggestions. He's a dream to have in the program.
Part of Javier's daily routine involves helping out in the community.
I go to a day program called the Lighthouse, which is on State Street in Springfield. And when I first started going there, I helped out with doing housing checks, and in December I went and I walked around the river down in Springfield to basically search and help the homeless that were living out there.
In this program, young adults learn how to take public transportation. They learn how to maintain a household and apply for a job. The ultimate goal is to get them ready to live on their own. On this day, Havier and Marcus helped one of the other young adults in the program move into his own apartment.
That's the goal, is to get everybody into independent living. Their own apartments, some may need some help afterwards, but for the most part, yeah, that's the goal.
MHA also runs 2 other residential youth in transition programs for young adults, funded through the Department of Children and Families. Christine Palmieri is the Vice President of Recovery and Housing for MHA.
So the goal of our program, especially the DMH program, but both of them really, is to teach those young adults the skills that are developmentally appropriate, that all of their peers who are 18 to 22 or 26 are learning about taking responsibility, about understanding kind of the roles of being a successful adult, like managing your finances and maintaining a household independently, getting along with other people, and understanding what relationships are healthy and move you toward your goals, and which ones to try to avoid.
Havier has always dreamed of becoming a Marine or a firefighter. Ultimately, he wants to serve others.
And I look forward to big accomplishments out of that gentleman.